Counting the kicks to prevent stillbirths. That's the goal of a public health campaign new to Ohio.
News 5's Olivia Fecto shows us how they're teaching pregnant women to recognize when something is unusual before it's too late.
Count the Kicks already has ambassadors in 23 states, including here in Ohio. One of those women lost her daughter to stillbirth 6 years ago.
My daughter Harper was stillborn on March 5th of 2013.
3 days before her due date, Carrie Davis went to the doctor and found out her baby's heart was no longer beating.
To say that it was devastating for my husband Mark and I would be an understatement. It was very hard. We were in complete shock. I was angry, and that's a natural feeling to have after, having a stillbirth. I didn't blame anybody, and I knew it wasn't anybody's fault, but I did blame myself, and that's hard not to do.
After Harper's funeral, Davis began researching stillbirth. That's when she found out about the Count the Kicks campaign, started in Iowa by mothers who lost babies to stillbirth or early infant death. She got involved and became an ambassador for the program.
So we want babies to start at 26 weeks if they're having a high-risk pregnancy, 28 weeks if they're having a normal pregnancy.
Here's how it works. You download a free app onto your phone, then pick a time of day when the baby is normally active, ideally the same time each day. Hit the little foot icon, and the app counts down as the user tracks 10 movements.
The movements are twists, jabs, rolls, anything really besides hiccups, which are involuntary movements.
The app helps women track patterns, figuring out what is normal for their baby.
Every pregnancy is unique and different, and if the mom notices a significant change from what is normal, and we don't prescribe what a significant change is, we want moms to be empowered to make that determination. We want them to contact their doctor right away for further evaluation.
Davis used Count the Kicks when she got pregnant again with her son Colton, 9 months after losing Harper. She used it again during her pregnancy with her second son.
Having a pregnancy after a stillbirth can be very traumatic. It's, you're worried, you're so sure something is going to happen again.
Davis says the app, along with going to all of her doctor's visits, helped her feel empowered. She wants other mothers to feel that way too, and says Count the Kicks has helped decrease the stillbirth rate in Iowa, where the campaign first began.
There's nothing that's ever going to bring my daughter back, but if it can save one baby here in Ohio like it did in Iowa, it would be worth it.
Across the U.S., the Centers for Disease Control says stillbirth affects 1% of all births, or approximately 24,000 stillbirths each year. In Ohio, the stillbirth or fetal death rate is 6.3 out of 1,000. In Cuyahoga County, it's slightly higher, 6.6 out of 1,000. Across the board, the rate is higher for black babies than for white babies. For more information on Count the Kicks, head to our website, news5cleveland.com. Olivia Fecto, News 5.